Well, we're hearing more and more about mental health needs, being more open to discuss it and hopefully seek help. Today we're hitting a topic that may not be as common to you. It's perinatal mental health. Joining us in studio is Kristen Kraus with Baptist Health. She's a licensed professional counselor who does both telehealth and in-person treatments and is listed as a provider with the Postpartum Support International. Kristen, thanks for joining us.
Thank you so much for having me. Excited to be here.
So I want to start with perinatal health.
Yes.
You know, what exactly is that?
Wonderful place to start. So perinatal mental health really encapsulates all the way from pregnancy to that first year postpartum.
Okay.
So we're trying not to use just postpartum depression. We really want to get the huge scope of treatment interventions for anxiety, OCD, depression, trauma, and also in cases of postpartum psychosis.
Okay, so how is that different than what would be referred to as like the baby blues that people think of?
Absolutely. So the baby blues is technically a non-disorder. We still refer to it because about 60 to 80% of women do experience the baby blues anywhere from 2 days to up to 2 weeks postpartum. And we know this is caused due to disruption in hormones and sleep deprivation, and that's normal. But what's key to note is if it's anything persisting symptom-wise after that 2 weeks, we really encourage people to get treatment.
And so if people think that they are experiencing this disorder and, you know, they're still, like you said, having those incidents, you know, how can they get that help?
Absolutely. So if they already have a trusted provider on their team, we want them to let somebody know, right? There are so many great screening tools in person, online. So that's the first step, is just contacting who you trust. And if you don't know who to contact, that is where a therapist, particularly somebody who's licensed, specializes in postpartum support, PSI is a wonderful resource. But definitely we want to screen, get people in the door. But if you have a great support system, let's go ahead and use that as a first stop.
Fantastic. And with, you know, this mental health, I know we were speaking over the break just about how important it is that people know the signs and then get the help. But you said that this is kind of something that maybe a lot of people don't even know about.
Right, absolutely. So about 1 in 5 to 7 women could have a perinatal mood and anxiety disorder, and 1 in 10 men can also experience depression. They can have changes in their hormones. It can present differently in men, but they definitely need help as well. So as a provider, yes, I care about who I'm working with, but I also want to make sure the family is on board and getting the support and tools that they need.
So if people want to learn more about this, is there a website they can head to?
Absolutely. So if you're wanting to see somebody within Baptist, please give us a call. Postpartum Support International has a online directory. It's free, it's international, where you can find help. They have a hotline that you can text or call, and lots of virtual support groups as well.
All right, Kristen, well, thank you so much for coming in and sharing about this. Of course, we will be right back with a final check of your forecast. Don't go anywhere.